Perfect. All right, welcome everybody. Today is September 21st, 2023. And if you're watching a recording of this, a lot of this information likely changed, hopefully changed, because one thing that you'll learn today is we still have a whole lot of uncertainties around our new vaccines for COVID-19 and for RSV that are hitting the market right now. So my name is Rebecca Navidale. I'm with the Arizona Partnership for Immunizations and will be your kind of MC for today. We loved seeing all of you and your people from your offices over the summer at our regular TIPS meetings. And we promised you when urgent things popped up, we would convene some virtual meetings. And we have been just overwhelmed with questions from all of you about these two new products that have hit the market, the new COVID-19 vaccine, and quite a few vaccines for different populations for RSV, which we are super excited about, and still one on the way, hopefully, that you'll hear about today. But all these changes are bringing a lot of clinical questions, but also a lot of questions around billing. How are people affording to be able to purchase these new vaccines? Our big disclaimer is that we still don't know all of the answers to all of your questions. And we ask you to try and all take a breath along with us and remember what it was like before there was a pandemic, because this uncertainty of how do we order the vaccines, when are we going to be able to get them, how do we bill them, what are the codes, all of that stuff is normal when new vaccines hit the market. So this is a reminder of what it's like in a commercialized vaccine world. We've been a bit spoiled the last few years with some vaccines coming out that were supplied by the federal government. So we are back to reality where the first few months after a new vaccine hits the market is a little bumpy. So we are along for the ride with you. And we have a whole lot to present. So I don't want to spend too much time. I think that's all my regular introductions. And people are asking about slides. We will post all of this and email it to you if you need it right after. You can just shoot us an email really quickly and we'll be able to give it right to you. So okay, so I want to introduce our three presenters. Oh, ground rules. This is a lot of information, so try to hold your questions to the end of the presentations. We're going to start with RSV and then we'll move over to COVID. So try to hold your questions to the end because hopefully we'll answer some of them. And yeah, I think without further ado, I will introduce, we're going to have two of our clinical folks, Dr. Nick Staub and Macrina Leach from Maricopa County Department of Public Health, and then Jennifer Tinney at the end of our time together from TAPI will talk about how you can actually get paid for this stuff. So Dr. Staub, why don't you take it away?
Great, thank you, Rebecca. Happy to be here today. I will hopefully be relatively short in my areas because I think you'll be more interested in the content that Macrina and Jen have to share. Can I get the next slide? So here we are at the beginning of our usual respiratory virus season. This slide is from CDC. They have a new website that can be linked to from their COVID website and other places. Really, it's looking at a combined view of all the respiratory illnesses that we are expected to encounter here in the next couple of weeks and months. We're really trying to pivot from thinking more about COVID to really thinking about the impact that all of the respiratory viruses have on us. We specifically here are looking at COVID, flu, and RSV because we have vaccines for those infections, but we know there are many other infections that everyone gets this time of year, all of which can be controlled to some degree with kind of some of our good practices, staying home when you're sick, washing your hands, covering your cough, all that stuff we're all used to. But we've also got vaccines. That's what we're talking about today. So This just looks at last year's COVID, flu, and RSV season. They all came a little earlier than usual. We saw flu and RSV certainly earlier than their typical seasons, followed by a rise in COVID, all of which you can see that black line on the top led to a pretty significant increase in respiratory infections October through January of last year. And what you see all the way on the right there is that we're starting to see an increase in respiratory virus activity, really being led here by an increase in COVID cases recently, but starting to see an increase in RSV cases locally. There was just a health alert out this morning from the Arizona Department of Health Services. We've had 3 weeks in a row of increasing RSV reports into them. So RSV is starting to circulate here. CDC had a health alert out last week, also showing that that RSV is starting to circulate in the southeast. So next slide. Can I get the next slide? I don't know who's driving.
Yeah, it's not moving for some reason.
Okay.
Any hints?
Or clicking your mouse on the screen and then push your arrow button, or however you're switching slides.
Thanks.
Okay, this shows Arizona specifically. So on the same site, you can look at both state and national trends. You can see we're actually a little higher in Arizona from a percent of ED visits than the rest of the US. Next slide. So we have some new tools out this season. RSV vaccines, I think, is what we're going to start with. Just a background on RSV. I think many offices online today know that this is one of the most common respiratory infections and causes a lot of hospitalizations for young children. Statistically, 7 of every 10 children are infected during that first year of life, and almost everyone gets infected by the second year. So affects lots of little kids. The youngest infants are at the greatest risk for severe infections. And we do see anywhere between 100 and 300 children die each year from RSV and its complications. Children aren't the only ones affected. We largely think of it as a childhood disease, but adults over 65 also have a significant burden of severe disease from RSV infections. You see there's 60 to 160,000 adults are hospitalized. 6 to 10,000 die each year from RSV infections. And we know that other comorbidities amongst the elderly lead to more severe infections with RSV. Next slide. RSV has a regular seasonality. You see it there in the light gray dashed line, usually late December or December through February and March is when we see RSV. COVID did some crazy things with our RSV seasonality. We had 1 year where we had almost no RSV. And then this past year, we had a very early season and very high, 4 to 5 times higher than what we typically see as our peak incidence with RSV. We had a lot of RSV last season. Some modeling from CDC indicates that we are likely to see similar RSV and flu seasons this year. So high levels again. So again, just modeling, but certainly preparing for what could be high seasons once again. Next slide. Again, I mentioned that the CDC put out a health alert. There's a link to it here. Again, seeing most of the transmission in the southeast at this point. Next slide. And we've got some RSV, new RSV vaccines. So Macrina, you want me to turn it over to you here?
Yes, I'm ready to go. Okay, so we have 2 RSV. Pardon me?
Oh, I was going to say we don't see your face, but you're letting us see your face now.
Yes, I'm here. So we have a few RSV products out. The first one is really an RSV monoclonal antibody for infants. It's Beyfortus. I don't even know how to pronounce it. What it really is a long-acting monoclonal antibody. It was approved by the FDA and then the ACIP and CDC for infants under 8 months in their first RSV season and then high-risk infants 8 to 19 months in their second RSV season. The nice thing about this is it is a single dose per season. It has proven they have seen in studies to reduce the risk of hospitalization and healthcare visits by 80%. And ideally, where kiddos would receive this first dose of RSV, the recommendation is actually if you're born during the RSV season, which they think is October through March, that you should receive that dose prior to discharge from the hospital. Okay, next slide. Okay, and this is what it looks like. So there are two dosages. One is for kiddos less than 5 kilograms at time of administration. You would use the purple plunger rod, which is a 50 milligram dose per half cc, half mil. I think one thing that we really got out of COVID, which has been really good for us, is that now everyone color codes everything. So I think there's a silver lining to the craziness that was COVID vaccines. And then if you have 5 kilograms or greater at time of administration, you're going to use 100 milligrams. And that's going to be the light blue plunger rod. It's IM administration. And again, ideally, this would be done with infants prior to being discharged after birth. Next slide. It can be co-administered with other vaccines. Because remember, it's a child that's going to be 7 months or younger, 7 months or younger at any time during that RSV season, which could be October through March. So we're going to have some kiddos who will have been discharged before they're able to get this. Contraindications are severe hypersensitivity to any ingredient. And listed here are the ingredients. So any severe allergic reaction, they would not be able to get it. And again, the most common side effect are what you see with all IM injections. You might see a little bit of rash at the injection site, a little bit of pain, swelling, or hardness at the injection site. Nothing that is unusual. Next slide. This is storage and handling. It's stored in your refrigerator from 36 Fahrenheit to 46, which is just like any other of your refrigerated vaccines. You can keep it at room temperature for up to 8 hours, but once it's at room temperature for 8 hours, it must be wasted. You want to protect it from light. You do not need to shake it, and you do not expose it to heat. This is going to be a little bit more complicated. Because it's a monoclonal antibody, but it's going to be through VFC. So we're just calling it a vaccine-like product. I think this is going to be really, for those of you who like change and challenge, this is going to be fun. For those of you who do not like change or challenge, this is going to be a little bit of work to try to explain to parents. Next slide. Okay, and then just jumping all the way to the grandparents of these youngins born, we have 2 RSV vaccines for adults, a RSV and a Brizo. Well, I can't even pronounce that, but they've been well advertised on TV, so I'm sure you've heard their names. It's a subunit vaccine. It was approved by the FDA and then recommended by the ACIP and CDC. For 60 plus in shared decision making with the healthcare provider. So I know that creates a little bit of challenge within physicians' offices, because you do have to have that discussion on whether or not it is appropriate vaccine for your older adult patient. It's a single dose this season. We really don't know what the recommendations are going to be moving forward. And it's an 83 to 89% effective in preventing infections the first season following vaccination. Next slide. So here is a RSV. It's a half a cc intramuscular injection. It is supplied in 2 vials, so it does have to be reconstituted. So it's a lyophilized antigen plus the adjuvant suspension. So you need to mix both of them to get the vaccine. This is stored again between 36 and 46 degrees Fahrenheit, so it's in your refrigerator. Once you reconstitute it, it must be used within 4 hours. If not, then it must be wasted. And then we go on to the next one. This is a 0.5 milliliter IM injection. It is applied in a lyophilized antigen is in a vial, and then it's a pre-filled syringe with sterile water and diluent. This again is stored in your typical refrigerator, 36 to 46, like all other non-live vaccines. Once reconstituted, it can be stored at up to room temperature. Do not refrigerate it once it is reconstituted, but it must be discarded after 4 hours. This one is a little bit more complicated. It comes with a adapter, and you have to use the adapter and connect it to the vial and then the syringe. But both vaccines need to be reconstituted and come with their own diluent. Next slide. So this can be co-administered with any other vaccine as well. So when we're going in for RSV season, in fact, today my husband got COVID, flu, and his RSV vaccine all at once. Common side effects are what you're going to see: some fatigue, headache, some pain at the injection site, some muscle pain, fatigue, myalgia, just those somewhat routine systemic and local reactions that you see routinely go away in about 24 hours. Nothing out of the normal. Now, where do we send our patients for RSV vaccine? Babies, really what the best case scenario would be that this would be administered at birth prior to discharge. Just keep in mind that all of these are really new vaccines coming out this season. And so just like any other new vaccine, we're just trying to figure out where do we get it, who do we purchase it from, and where's the best place to administer.
Well, Macrina, I think we're hearing from the other counties that we're all of the counties throughout Arizona are still figuring out
Right.
whether this will be covered in their birthing hospitals. So we do not know if this will be in all the birthing hospitals. If you still round in hospitals, please continue to ask. If you're getting a lot of questions from patients or prospective patients, please tell the birthing hospitals that you're getting those questions, because just statewide, we really don't know if it's going to be in birthing hospitals for access patients or for privately insured patients. We're still learning whether pediatric or family physician offices will carry this, because like is kind of implied in the chat, it's very expensive for your privately insured people, the people that you're paying for those acquisition costs. So we're still learning that. And I think all of the counties, the county health departments are kind of in the same boat because of the cost of this vaccine or immunization. They're not sure how much they're going to be able to purchase either. So for privately insured people. So we really are still learning how patients will actually be able to access it for their babies. And the same goes for that 60 to 64 age group. We're hearing a lot of counties are still determining whether they will be able to purchase that for privately insured people. But we are hearing that the pharmacies are giving it for 60 plus, 60 to 64, and then again for 65 plus. Are you hearing the same, Macrina, for Maricopa
So
County?
we're hearing that 65 plus are able to walk into a pharmacy without a script. We are hearing a few folks saying that when they go to the pharmacy 60 through 64, that they're being asked to bring a script. So it looks like if you're covered under Medicare Part D and you're going to a pharmacy, that it's easy.
Right.
The 60 through 64s, some places are being asked to bring a script. I think this is just, it's really complicated, because I think even as a health department, we're trying to figure out what is our role and finding the money and who's going to be doing it. I think these vaccines were the media told us all these vaccines were coming before anybody had a chance to know how to get these vaccines in their office.
Yeah.
And-
But again,
Yeah.
oh, go ahead, Jen.
Just to add in regarding the pharmacy piece, and I think every pharmacy is different. The health plans are still catching up to get the codes in the system. But my husband got RSV last week, and I'm saying to him, did they charge you? Did they check your insurance? And he is just 60. And he said, nope, no problem. I went in and requested it. They gave it to me. I had zero out of pocket. And he's the first one I've heard that from. So I think it depends on the pharmacy, the patient, and the insurance, whether they needed a script or if they charged
Right.
an out of pocket that may be refunded. Everybody's just trying to figure it out, like you said.
Yep. And my husband is of Medicare age. He's 73, but he's covered under my commercial insurance through my employer. So he's sort of that odd one. I think the idea is if you refer patients to the pharmacy, just have them ask a lot of questions.
Yeah. So we think, just to summarize, where do you, if you don't have it in stock, you've already made the decision that you won't be able to carry it for this season. For your 60 plus, check with your local 60 to 64, check with your local pharmacies where you would normally send your patients to see whether they're requiring a script or not. For 65 plus, it is covered by Medicare Part D, and we're hearing that it's pretty accessible in pharmacies. We're not hearing a ton of problems actually for those groups yet. They're able to access it in the pharmacies for those older adults. For babies, we do not know whether birthing hospitals will have this or not. October's pretty close. So if you round in those birthing hospitals, please be sure to let them know if you're hearing demand from your patients. So wish we knew the answer to that. Hey, Macrina, before we move on to COVID-19, and I want to make sure I pause here because if there's other questions too, we have some time. Pregnant women.
Oh, pregnant women. So tomorrow the ACIP is going to meet on immunizing pregnant women in the 3rd trimester. So using the same medical logic that we use with Tdap and flu, by immunizing mom in the 3rd trimester, it will provide that baby protection of birth. The ACIP is meeting tomorrow on the 22nd to discuss it. And I believe it's only one vaccine product that we're just going to have to wait to see what they say. But so stay tuned. There'll be more information coming tomorrow afternoon.
And again, if you have pregnant women asking about it, tell them to ask their birthing hospitals. That's what we're telling pregnant women calling us. Ask your birthing hospitals because they need to know if there's demand for this. Anybody else have other questions? We have, what's the name? Oh, what does high risk for over 8 months mean? I had that as a private one. So we said that it was for infants during their first RSV season through 8 months of age, or if they were high risk after 8 months of age. What does high risk mean?
These would be children born. These would be children with any chronic medical condition that would make them at more risk for severe outcomes to RSV. So really any condition that would make them Synergist eligible would make them eligible for this one as well. Right.
And is this replacing Synergist?
It should. It most likely will. Am I right, Nick?
Yeah, and I would just say, I think availability is the big question there. So I think for this season ahead, if you have a patient who meets eligibility for Synagis, I would certainly try to get them nirsevimab. But if you cannot, I would still schedule and plan for them to get Synagis.
Okay. And we don't think it's available for order in ACES yet. But will be coming soon. And how long is it effective? Will they need a new one next season?
So the data is pending for that. So both for the adult RSV vaccines as well as the monoclonal vaccine-like product for infants, we're waiting to get more information on whether a dose each season is necessary or whether it can last for 2 seasons or longer.
Okay.
And I had another private question. It is about timing for that. So for babies that are born, ideally give it in the hospital if they're born during RSV season, but especially in this first year of catch up, you know, you might have a 2-month-old in your practice, give it up to that 8 months in your practice, even if they weren't born during RSV season.
Yes.
Correct.
Is it shared decision making for 60 to 64 or is it 60 plus?
It's shared decision-making for 60 plus is what the ACIP recommendation says.
All right. Are there special accommodations for preemies? That was one that came up on our registration form.
So,
Give me
there's no specific recommendation for premature infants. Again, with for nirsevimab, it's all infants. And then if the question is accommodations in terms of any special access, we don't know that yet.
And again, I would just remember that there are 2 dosages out there, one for under 5 kilograms. So that's probably which makes it a little bit more complicated because then instead of carrying 1, you'd have to carry 2, which also adds to the complexity.
What if they already had RSV? Should they still get the vaccine?
So a previous infection with RSV is not a contraindication to receiving it. I would have a conversation with your pediatrician as to what the relative benefit of that vaccine is after a documented infection.
Any other RSV questions? All right, can an access patient pay cash for the RSV vaccine? I don't think you're allowed to accept cash for any access from any access patients for any reason, are you? Or just that one?
No, you can't take cash from an access patient.
But for RSV, this will hit VFC, so it won't cost you anything to purchase for VFC patients. For you to purchase the product because you'll run it through like your VFC vaccines. It's the privates that you'll have to purchase for.
Right.
Which is great. It's just we have access points is what we're still wrestling through. Is it the same indications for adults?
So the only indication for adults is really based on age. So it's just 60 and over. And again, it is with that caveat that it is recommended that you have a conversation with your healthcare provider. But again, we've been hearing that certainly for 65 and over, that they're able to get these vaccines in retail pharmacies without any prescription, and that for 60 to 64, it's variable.
And Jen, there's a couple references actually about the cost of the vaccine. I'm hearing between $400 and $500 a dose for private insured. What are you hearing?
For the monoclonal, it's going to be right around 500, about $495. For the babies, for the monoclonal. For the vaccine for adults, it hasn't been posted anywhere yet. So typically the CDC updates their vaccine retail list price, and it hasn't made it to there yet. I have heard that one is right around 200 and one bumps up a little closer to 300, maybe about 285. But those of you who have already ordered it may have a better idea, but it hasn't been posted yet.
Right, it has not been posted. We saw one was between about 180 to 230.
And the age is just 2 to 8 months unless the child is older than 8, what's the indication? Is it just for babies for 8 months? What about kids and teens is the question.
There's no recommendation. The RSV, the vaccine type like monoclonal antibody, is really just for the first RSV season, and then for those children who are high risk during the second RSV season. So those older kids and adolescents and teenagers, there's no recommendation right now.
Okay. And is the indication for adults if they've had this virus, again, Dr. Staub, no contraindication if they've had the RSV vaccine? Or if they've had the virus, they've been sick with it last year, documented case?
Yeah, certainly if they were sick with it last year, there's no contraindication they should get vaccinated this season. Whether or not they've had an infection this season and then get the vaccine, there's no contraindication to getting it.
Okay. Yeah, Dr. Offit, who from Children's Hospital of Philadelphia, has been doing a lot of educational things on this vaccine, and he keeps starting all of them saying, hey, adults, we've all had RSV. This is our booster. Like, this is a booster. We've all had RSV. Remember that. So, okay, so let's move on to COVID-19. If you have more RSV questions, go ahead and throw them in the chat. We'll get to that. The other thing we do in these virtual tips is just keep the line open for like 15 minutes at the end. If you don't have to rush back to patients, where you can ask some additional questions or ask questions of each other about how folks are thinking through whether to order this for your patient population. So, all right, COVID-19 vaccine. And we've got lots of questions just like about what's up with the variant, what are our rates like? So we on our registration form. So Dr. Staub's going to review some of that too.
So I showed you at the beginning a little bit of what's going on with all the respiratory viruses, including COVID. This is a little more specific COVID-19 data. Hospitalizations across the US are slightly up, as I indicated. And so we're seeing more COVID recently. That is the same here in Maricopa County. It's important to note, though, that we talk about an increase in hospitalizations as a percentage week over week. So while you may see percentages around 10%, that you have to keep that in the context that we are still seeing low hospitalizations for COVID-19. So those percentages are relatively small numbers, and the same goes for those deaths that are being reported. Next slide. And again, here is specifically looking at Maricopa County, and you see that increase of 10% in hospitalizations. That's week over week, but we're still at what we're calling a low hospital admission level for COVID-19. Next slide. In June of this year, FDA recommended that the manufacturers, so specifically we're talking here about mRNA vaccines, so both Moderna and Pfizer were recommended to manufacture a vaccine that targeted the Omicron subvariant XBB 1.5. This is very similar to the way that we think about flu vaccines. We look a couple of months ahead of time and see what's circulating, oftentimes in the Southern Hemisphere. And that's what goes into the formulation for the annual flu vaccine. Very similar way that we are thinking about the COVID vaccines. Now we know that XBB 1.5 is not the predominant strain that's circulating, but a lot of investigation has gone into whether the currently circulating strains are effectively boosted or protected against with this vaccine, with this XBB 1.5 vaccine. And so specifically, we have looked at, or the manufacturers have looked at EG.5 and FL 1.5.1, which are the predominant variants at this time. And the reports have been that there's been a robust immune response to those variants with this XBB 1.5 vaccine. So no reason to believe that because we're seeing different variants circulating now that we're not going to have good additional protection from this vaccine. Also, I will say at the same time, for these currently circulating variants, we are also seeing good effect from the antiviral medications, so Paxlovid, as well as they're being detected with the over-the-counter tests. So there's just news out that You can now, I believe in the next week or two, are going to be able to order additional over-the-counter tests through the same federal mail program. And we know that those tests are detecting the currently circulating variant. That's good news. Next slide. Macrina.
Okay, here I go. So the mRNA vaccines, they've been updated to the XBB.1.5. They were approved by the FDA and recommended for everyone 6 months of age and older, and the CDC and ACIP made recommendations. The good news is that for everyone 5 years of age and older, it's going to be a single dose, but administered at least 2 months after your last vaccine. For our kiddos between 6 months and 4 years, again, those are a little bit more complicated to vaccinate, but there's a great handout that I think that is available, that the AAP that is on the TAPI website that can show that for you. And last season, those who received the 22-23 COVID-19 vaccine, we saw greater protection against illness hospitalization than those who did not receive it. So again, COVID vaccine is much like we talk about flu vaccine. It may not stop you from getting COVID, but it's truly going to stop you from being hospitalized and having the worst outcomes, long COVID or even death. Novavax is still waiting for FDA approval. So just continue to use the vaccine that's out there if you have it. That is still licensed for use. Again, most people 5 years of age and older will need a single dose. Again, it does get a little bit more complicated for those younger kiddos, but there's a diagram that will help you figure that one out. They can be co-administered with any other vaccine. So it's perfect when those kiddos are coming in for their flu to go ahead and get them with COVID and everything else at that time. The products can be mixed and matched. Both products are available. So if they start with one, they can end with another. I've got a lot of questions. I received Pfizer and all my previous doses. Can I go get Moderna? And the answer is yes. You just get whatever COVID vaccine is available to you. Next slide. Okay, so this has changed since I made this slide. These are all the COVID vaccines available in ACES. They just recently added Moderna for 6 months to 11. So now you can order an ACES Moderna vaccine as well. Moderna, the nice thing about Moderna is it is a single dose vial for those kiddos. All these other vaccines are available to order through ACES. Next slide. And storage and handling. So here we have Pfizer. The commercial name is Comirnaty, which I can never say correctly. You can store it in your ultra cold freezer if you have one. No freezer storage. Once it arrives, you keep it at refrigerator temp for up to 10 weeks. A diluent is only required for 6 months through 4 years. And these are the packages that are available. Pfizer 12 plus, you can get in cartons of 10 dose, 10 vials, single dose vials. You can get 5 to 11 in single dose vials in 6 months through 4 years. You get a carton of 10, it's 30 doses, but it's 3 doses per vial. Once you puncture any of these, once you puncture that vial, it does need to be used within 12 hours. And the next one, Moderna. No ultra cold storage at all. It can be stored in the freezer until the expiration date. Once you move it from the freezer into the refrigerator, it's good for up to 30 days, as long as it's unpunctured. This vaccine does not require diluent. It comes in cartons of 10 vials, 10 single dose vials. For ages 12 and up, it's 0.5. For ages 6 months through 11 years, it's 0.25, and it is currently available to order in ACES. So disregard that currently not available. Next slide. Where do you send your patients for COVID vaccine? Rebecca, I'm going to let you take this one on.
Okay, so for kids under 12, it is a little bit challenging. A lot of private offices have never ordered COVID vaccine. So aren't used to ordering it. That's not in their regular vaccine delivery workflow. So they've been referring to the counties and to pharmacies for their younger patients and to other community events. You'll carry, I think most counties are planning to carry this vaccine for all ages. That's what you guys are doing, right, Macrina?
Yeah, we're carrying the vaccine for all ages. We have our VFC 12, we have our VFC and our uninsured adult vaccine for 12 up. We're waiting for delivery of our 11 and younger, and we have not received our vaccine for our privately or commercially insured patients yet.
Okay, so yeah, pharmacies, we're still calling around to try and see what the big chains are doing. Their websites are changing daily. So like one day it'll say, yes, we're going to offer it when we get it for all ages. And then a few hours later, it will say just for 12 and up. That seems to be a big cutoff for people. So the answer for kids is we don't know. If you're not carrying it in your offices, make sure you call your county to make sure that they are a place where you can refer children of all ages to. Call your local pharmacies to find out what ages they will give the vaccine to. And just know that a lot of people haven't gotten their vaccine yet, especially for the younger age groups. For uninsured adults, we can send those people to the counties. You also, when you're on the phone with your pharmacies, ask them if what their policies are going to be. They might not know yet. You might have to wait a few weeks because there is a bridge program for some uninsured adults. It's very small funding for that. That will allow some pharmacies to be able to offer vaccine. Jennifer will talk about that. For your insured adults, we do expect this to be covered fully. So again, they should be able to access, adults should be able to access it through any pharmacy if you're not carrying it, and Medicare as well. So we'll cover this. So again, we're just not sure about the kids. Oh, and get your flu shots. Yes.
Oh yeah, let's not forget about flu. We're talking about respiratory season. We spent a lot of time on RSV and COVID. Please get your flu vaccine. You'd hate to get all the other stuff and then find out you forgot flu.
Yeah.
So get your flu.
So before we dig into billing, which I know people love to dig into and really are excited about, is this going to be an annual vaccine? And I don't know who wants to take
Yeah.
That's the direction it's headed. So, I mean, we're expecting that to be the case. I think unless we see some change in transmission that is unexpected, this is likely to be a seasonal vaccine like flu.
Okay. And Sherry, thanks for sharing what you were able to dig out about Pfizer's return policy of COVID vaccines. So be sure to look at the chat for that. Any other questions on COVID-19? We had one on the registration. What is there an additional dose for immunocompromised?
Not that I've seen, no.
Remember this
Oh,
vaccine.
wait, yeah,
Oh,
Wait, there is?
they can receive an additional dose. It's kind of that shared clinical decision.
Oh,
Can.
thank you, Jennifer.
it can. How long after? Does it matter?
2 months.
Ordering, we're gonna get right to ordering, Sandra, in just a second. Since COVID vaccine is now available through VFA, what is the recommendation for consent form? So we will get, can you hit on that too, Jen? Because she's going to talk about the VFA program. Deirdre's asking a question that also came up on our registration. What's the difference between this and the other one? If any.
What's the difference between which
this year's COVID vaccine and last year's COVID vaccine?
Yeah, so the difference is that update to the newer variant, right? So each of these new variants, the difference is mostly in their spike protein. So you all will remember hearing a lot about the spike protein. So the idea there is that when we update it each year to a more recently circulating variant, that you're more closely you're more closely engaging your immune system to be fighting the variants that are circulating. So
Okay.
it's very much in the same way of thinking about the flu vaccine.
Thank you. And for pediatric patients, can you only vaccinate your own patient, or can you vaccinate other people, other patients? And the answer is you can vaccinate whoever that you're licensed to be able to vaccinate. The billing, that you would be billing someone who's not your patient, so collecting all that insurance information. Is that how you would, Jen? Yeah.
Yes,
And we know
exactly.
some offices do that, take other patients for COVID and have. So if that's something your office is looking into doing, let us know, because we can hook you up with some other offices that have done that, and they can maybe talk you through what they had to consider for billing. And they can also provide COVID vaccine. Pediatricians can provide COVID vaccine to older as well, right? To parents and grandparents.
Yeah, we have a lot of practices who do that, and it's especially helpful because typically the child has the same insurance that the adult does, so you're able to still bill for that, kind of depending on how your insurance contracts work. But it was really exciting when a lot of the practices started doing that with flu, and I
Yeah.
think COVID could be one very similar to it.
Yep. How much are these ones? These aren't cheap either, right?
Oh, so what we've discovered, anywhere between $100 and $130 for the COVID vaccine.
Is that what you're hearing too, Jen?
Yeah, and I think I have the prices on the next list, that we do have the
Okay, perfect.
price list for that one.
So anyone who received a Pfizer or Moderna bivalent 12 years plus would still need a 2023-2024 dose.
Correct. Correct. It's just like flu. If someone gets a flu vaccine on June 29th, just a day before it expires, yeah, and you need to get a flu vaccine a couple of months later. Yep,
Okay.
you need to get it. There is a question here about an at-risk 4-year-old for RSV.
Yeah.
No, so far the ACIP recommendations only discuss children ages 8 to 19 months through the first and second RSV season. So they do not discuss recommendations for a high-risk 4-year-old.
All right. I want to make sure that we have enough time for billing, and then we'll keep the line open for other questions. So, but one that I just want to make sure we say out loud is, if you are ordering VFC vaccine, that can only be used for VFC patients, for VFC eligible people. So you can't, if you accidentally use a VFC vaccine on a privately insured person, then you follow the process to be able to account for that dose. There's a form that you have to fill out, but you'll end up eating that money. They won't, just remember, VFC vaccine has to go to VFC patients.
Yep.
Okay.
And I think the best way to think about that is, this is just like flu now. COVID is just like flu. Like, you purchase flu for your private patients, you use flu from VFC for VFC patients. It is now off the, special treatment that it got all during the pandemic. It's now just a regular old vaccine. And I think the next slide goes over that a little.
Okay, good.
Am I ready to start?
Yeah, go for it.
Yep. So how to get COVID vaccine for your clinic. So for your privately insured patients, you can purchase vaccine directly from Pfizer, Moderna, Novavax, or through whatever vaccine distributor that you use, typically for all your other private vaccines. So for kids 0 to 8 who have Medicaid, who are uninsured or Native American or VFC eligible, you can order COVID vaccine through the VFC order sets. So this means too, if you were a practice that was not signed up to give COVID during the pandemic, but you are a VFC provider, COVID will now be on the regular VFC order set. So even if you've never had COVID before, this is a good chance to order some through VFC and to be able to get those kids caught up on this new variant dose. So The uninsured adult bridge program, I know a lot of people are talking about it because it's in the headlines all the time. You know, we have this bridge program for COVID, but it's going to be very limited. So again, we just need to think about this vaccine like we do every other, just like we do flu. So for the bridge program, it's going to start in early October. So none of those doses are available now. It is only for uninsured patients. So if a patient has any other kind of insurance, you can't use the bridge program doses. So somebody had asked earlier how to bill for the bridge program. You can't bill those now. This is strictly an uninsured patient, and you're giving out the vaccine, which is why it's happening primarily in county health departments. The FQHCs, the community health centers in Arizona, will be allocated a certain percentage of those, and a few other additional VFA providers will get our state allocation of the bridge doses. So we have a couple of fire departments that will get some. Primarily, it is partners who give vaccines to uninsured patients. There is a second national allocation that will be coming into the state as well, but that's through a national system. They're working directly with Walgreens, CVS, and a few non-chain pharmacies, kind of like your local mom and pop places, and they will be given vaccine directly. And that's all on a federal level, and it doesn't impact kind of how we order them through the state. So if you are a VFA provider, I think we've been throwing that acronym around. There aren't very many. It's vaccines for adults. We have a tiny amount of money every year that we're allowed to buy vaccines for uninsured patients. And we call it the Vaccines for Adults program. Anyone who's currently registered as a VFA provider can order bridge doses, and that will show up on those order sets in ACES, just like on VFC. For other FQHCs that are not currently part of the VFA program, they will be able to sign up very easily to get those bridge doses. Okay, so now that we kind of have the lay of the land, if you want to go to the next one, I'm not going to go into these into detail, but we are providing all of the billing CPT codes based on the age and which vaccine it is. And we also included things like gray cap, blue cap, yellow cap, and you're right, Macrina, that has helped tremendously for people to know which is which instead of all of just tables of codes. But the payments are higher than what we're seeing as the CDC retail costs. So you can see for the Moderna products, they're $128 is the retail cost for that. And the CMS payments are right around $145. So there's a margin above the cost of the vaccine. And this is going to be billing and reimbursement just like you do with flu doses. So you know, you've got a cost and then you hope the reimbursement is high enough to cover the cost and then some, and these have a little bit of cushion in them. So for the Pfizer's, those range from, it looks like $57 a dose up to $115, depending on the age indication for that vaccine. And then the reimbursement does have a margin above the cost of the vaccine. So rest assured, you should be reimbursed adequately for the cost of the vaccine for privately insured patients. You want to go to the next one? The hallelujah moment in COVID is that for any of you who gave it before, you remember that each type of vaccine and each dose number, you had a different admin code. That is all gone. All of those codes will be completely retired in the next 2 months from CMS. So all those previous codes you used for the administration of a COVID vaccine are dead. But there's only one now. Now we have one admin code for COVID vaccine administration. And right now it looks like CMS and Access are keeping the payments right around $40 per admin fee. There is also an additional fee if you go out to homebound patients and give them a COVID vaccine at home. You can charge the $40 admin fee, and you can add an additional code for $36 for that trip to that patient's house. The standing orders, a lot of people have asked about these, you know, during COVID, during the pandemic, the standing order sets came out with the vaccine, and that's not the case anymore because we're back to regular vaccine rollout. So the standing orders have not been updated yet, but they will be available at immunize.org as soon as they do. And we'll continue to look for those and let you know if we see any. You want to go to the next slide? So if you have flu and COVID vaccine and plan to have clinics, it is no longer required that you report your daily doses to vaccines.gov. However, it is highly recommended to advertise your clinics and let patients know what you'll have available. And please consider listing which vaccine age ranges you offer, if it's 12 plus, or if you also have baby vaccine available. And all of that information will show up on the bottom. You can see on this sample that I brought up, it shows CVS is indicated as a bridge access program. So that federal allocation going directly to Walgreens and CVS is indicated on vaccines.gov. So if you have an uninsured patient and you don't have any vaccine to give them, you can use vaccines.gov to help them find one of those uninsured doses. And I left the link on here for providers to set up their clinics on vaccines.gov. Next slide. Okay, so these are the payment codes for RSV vaccine. And this is still, we don't have a lot of information yet. We've got the codes, the NDC numbers, so you know what those are going to look like. The age ranges for each one, the vaccine plus the monoclonal that'll be given to babies. But we do not yet have CMS payments or the CDC vaccine retail rate, those that haven't been posted yet. So again, this is like when we typically get a new vaccine, it just takes a little while for all of those things to catch up, and they haven't caught up yet. We do know the cost of the monoclonal is right around is $4.95. That's the CDC retail list rate. The one thing that's different on the RSV monoclonal is it is not a typical admin code that you use a particular injection code, and your encounter code is different for that. But I've provided that information down there at the bottom in the last piece. So if you want to go to the next slide. So really good news on pediatric vaccine counseling code changes. Many of you know if you give a combination vaccine to a privately insured patient, you can bill for the first antigen, and then you can bill for each additional antigen using a different code. But Access was not following that procedure. They had not agreed to that, but Access now has changed that. So they are paying for the additional antigen code, and they have added new codes for when you counsel a patient about a vaccine, but you don't give one. So all of those times in between when you're talking about vaccines, but you can't give one, you now can get paid for it. Rebecca, did you have your hand up?
I was clapping, and thanks everyone who's been talking. Jen and I were saying, we think it's been like 12 years we've been working on this. So thanks to all who have talked with Access about this, which I'm sure they've always understood. But what a big fiscal note for Access. This is wonderful.
I know it was a huge change, and they had to get an override through CMS, and it's phenomenal, but they heard everyone. And then they went one step further by implementing these counseling codes when no vaccine is given. If you want to go to the next slide. This is the language that Access has put out, and a link to that, update memo for how you use these codes and the costs that are associated with those. So again, when you talk to a family about the importance of vaccines for children, you can bill for that time that you talk to them in 15 and 30-minute increments. And then there are separate counseling codes for COVID. So if you talk to them specifically about the need for COVID vaccine, you can bill that on a separate code outside of your general routine vaccine counseling. Okay, the next slide. Okay, so other vaccine policy news, I'll be real quick to wrap this up. A change this year, there's no out-of-pocket costs for Medicare Part D vaccines. So if you refer patients to the pharmacy, last year, sometimes they would be charged $75 as a copay. There is no charge. It is first dollar coverage. So there will be no out-of-pocket cost in a pharmacy for Medicare Part D vaccines. All vaccines on the CDC schedule, including high risk and those under shared clinical decision-making, just recently A ruling happened where, and CMS has ruled that it is included in the ACA preventative coverage. So most health plans have to pay those vaccines with no out-of-pocket cost either. There used to be a problem with shared clinical decision-making. That's changed in the last 30 days. COVID vaccines are covered by most plans the date that ACIP voted on it. So when ACIP voted for this new updated COVID, from that date forward, COVID vaccine is covered. But for every other vaccine, plans have up to a year from the date of ACIP's vote to cover those vaccines, which is why we see this with this RSV vaccine, and we're calling it like normal distribution. We don't have the payments yet. We don't have the prices yet because it takes time for all those systems to catch up and get the codes loaded. But all the vaccines on the schedule will eventually be covered and reimbursable. And I think that was it.
And it is 1 o'clock. So I know we're going to have a lot of people run off to patients. We will keep you posted, through email about any changes, and keep bombarding us with your questions, because it helps us learn what's all concerning you and, what's really happening on the ground. So please keep those communication lines open. We will keep this line open for another 10 or 15 minutes, to just get through the rest of the questions. And Jen, I think I'm going to start with counseling, and then go back to the other questions that hopefully Macrina can help us with as well. Are the counseling codes are for adults and children?
Children up to age
Children
21.
only.
Yep. So through
Okay,
the
so up to age-
EPS, EPSDT visits, access bumps that up to age, 21 beyond 18. These codes follow that.
And you would check, these are for access patients, for your Medicaid patients. Only check with all your private insurances and their plans to figure out if that's in your contracts. The same thing is in your contracts, for your private insurance. The good news is a lot of times our privates follow access in our state. So hopefully this is something, if they're not covering now, they will start to be. And will the counseling only be for providers or MAs as well?
A qualified provider. So I think in this case, it's going to be, physician or MD, DO, NP, nurses also qualify for vaccine counseling. But we can see if Access has any additional guidance on that.
Okay. And can we, Laura, just throw the slide up again on that counseling codes? Because I'm getting some private stuff saying, can we reiterate the counseling code stuff? And when did it start that they will now pay for additional antigens? When did that start?
I don't know when it started. I heard rumors that it was in the October override, the CMS override, or, whatever they do, but hadn't seen anything on it, and just finally found the memo that they put out just fairly recently that goes over both of these. So date wise, I'm not real sure. We did some test claims for the county health departments, and some of the plans were already paying the multiple antigen, and that was, I believe, in August.
Okay, so it's still fairly new.
Fairly new.
So, and remember, this will be like any other new code that's coming in, and it will be bumpy. And okay. And again, you're not billing, you're billing access, the access plan for your access patients, and then the private plan for your private patients. So we don't know if the privates are covering these new counseling codes or not. You'd have to bill them.
Yeah, and private has been covering the multiple antigens. So when you give the combo vaccine, they've been covering those for a while. And these are the new non-vaccine counseling codes. CMS adopted them, and typically private plans follow. I don't know how long that'll take, but we should see it creep over.
And I think this is the perfect slide of what they're looking for. And I will get.
Let me see if you can post that link in the.
It won't let her click the link on the bottom. If we could throw that link, actually, maybe Nicolene, if you could dig in there, or if Laura, somebody can dig that link and put it in the chat, that would be really helpful.
I've got it. I'm
Okay.
posting it right now.
And we will be sure to send the slides. They'll be posted on our website and you'll be notified. Okay, so now I'm gonna come back up. I think that's the bulk of the counseling ones. I'm gonna come back to some other questions. So wastage, there's been some conversation about in this in the chat about wastage. So ADHS did let us know that at this time, COVID-19 vaccines will not count towards your 5% wastage and will not be included on the provider report card. So for COVID-19 vaccines, that's what we were notified. Looks like some people were notified differently by ACES when they called ACES and talked to reps. So we will get confirmation about that and request that they send out official notice to all of you. So just know that that's happening. Will vaccine labels be updated, including beyond use labels? Do you know, Jen or Macrina?
Rena?
I don't know what that,
I wonder if it's that, yeah, whoever asked that, are you still on? Would you be able to,
yeah, can you clarify? I don't know what that,
Brenda, are you still on? Let's see.
I think if it's COVID, all of those COVID labels have been changed. You know, there's different color caps. The labels have changed and they say 23 to 24. COVID vaccine 23 to 24. That's part of the short descriptor on the CPT code. It indicates this is a different one than the bivalent or the original.
Sorry, I didn't know that the question was directed to me. Well,
Oh.
I was talking about the storage labels in the vaccine fridges. When you're storing either in the fridge or the freezer, we normally used to have on the CDC storage labels or beyond use date labels, referred to as bud labels. I'm not sure if those are getting updated.
I don't know. I went searching yesterday for the standing orders standing orders, and all of those other items that, used to pop up when a new COVID vaccine came out, they're not there. So it might just be that this is kind of how you do your regular vaccine. Whatever labels you guys get with flu are probably going to be similar to COVID. Macrina, you guys?
I don't know the labels. Are you talking about the labels for when you
Stickers.
transfer it from, like Moderna, when it comes from refrigerator to freezer, then there's a label you put on and it says do not use beyond this date because it's only good for so long in the refrigerator. I don't know if those labels are going to come out or not. I haven't seen them.
We can put that up though, too, huh, Jen? Ask that.
Yeah, we can. We
Yeah.
can ask the CDC all of these things. I asked them about standing orders yesterday, so I'll just
Yeah.
kind of.
And that had come up
all
too.
of it.
So Macrina, while you're unmuted, if they got the bivalent this year, do we give them the updated COVID
Yeah.
vaccine?
Yes. If you got the bivalent this year, 2 months after you got the bivalent, you can get the monovalent. This is a whole new strain that we're immunizing against. So 2 months after your bivalent, you can get the monovalent, 23, 24.
And then there were a bunch of questions around VFA, Jen, which I'll scatter in here, but one was just, what about deputized providers for underinsured? So do you want to just review who gets, like, deputized, who gets VFA, who doesn't?
So deputized for underinsured is a VFC subset. So that they would be able to order it through VFC, but not through VFA or Bridge. So VFA is such a limited amount of vaccine that primarily it goes to the county health departments because, again, it's for all uninsured. So there's a cost that goes for you guys when you give a vaccine. You've got the nurse cost, the clinic cost, and it's that recognition that when you're giving one to an uninsured patient that you can't charge anything for. The thought here is that vaccine just remains in the safety net clinics, the county health departments who have another budget to continue to function so they can give out vaccine to uninsured patients because they don't have any payment associated with it. So the VFA program is our county health departments. Right now, it is a handful of FQHCs that partner with those county health departments and a few fire departments. And that's all that has ever been on that program. It's not a lot. Yeah, I think Macrina runs out of hers within, 60 days of when she gets the allocation.
Right.
So it's not a
very
lot of,
small amount of vaccine.
yeah. So it's been a limited number of providers. However, with the bridge program, it goes through the same funding source as VFA, which is why we're kind of tying them together. But it is for all FQHCs. So if you're an FQHC and you currently don't get any of the other VFA vaccines through your county health department, you'll sign a one-page agreement saying that you'll, be a good steward of the vaccine, and then you'll be allocated bridge doses. Beyond that, we're not going to have any other partners that have access to those bridge doses, because it's not very many. It's like 100,000 for the whole state. And like flu vaccine, it's coming out in a trickle amount. So we don't have 100,000 doses, mid-October. We're going to have like 1,000, and then we'll have 2,000 the next week. It's going to come very slowly. So it's going to get used up primarily by the FQHCs and the county health departments who are doing uninsured clinics.
And for clarification, VFA bridge COVID vaccines can only be given to people totally uninsured.
Totally uninsured. So you can't bill it, and you can't ask them for a cash fee for the admin part.
And did you review where they can order for the bridge program for clinics that are not VFA? Oh, you have to be VFA, right?
Yeah, if you're an FQHC and you are not VFA, then you can contact ADHS about signing that one-page agreement, and then it will show up in your VFA order set. So you'll be given another order set. You'll have a VFC order set and a VFA order set.
And what if they are not VFA?
They have to sign the agreement, and then it'll be added to their ACES inventory.
Okay, so contact ADHS, whether you're VFA or not, if you are an FQHC and you want to do the bridge program for your uninsured.
Right. If you're currently a VFA provider as an FQHC, it's automatically going to show up as soon as we start getting allocations.
Okay. Where to find schedules for updated Moderna and Pfizer? We'll be sure to throw those on the website. Will a modifier be required on the M code?
I have no idea. We haven't even tested it yet. So
Okay.
we haven't billed them. We have absolutely no idea. I'll see if I can dig anything up through Access and add it to the resources.
I have another one that I think you're going to say we have no idea. We've not done it yet. Will Medicare and insurance companies pay for the second dose of COVID? If they need it, if it's a high risk.
Yes.
You think so?
Well, not without problems and it being bumpy. But that's the case whenever we get a new vaccine. It can take months for the codes to get loaded depending on the plan. We're still not being reimbursed for the codes, for the COVID codes from May for 1 or 2 plans. They just haven't caught up yet. They will eventually, and then they'll pay us for those back claims that we put in. But it can take time. And with this new vaccine, we're going to see the same thing. But since that ruling came out just a couple of months ago, that anything that lands on the ACIP schedule has to be paid by any of the plans that have to follow the ACA guidelines. We know we still have grandfathered ones and we have special circumstances, but for the majority of plans, any ACIP recommendation has to be covered. So that second dose footnote will be in the footnotes. It will likely be denied the first time you put it in, and you're going to have to take it through an appeal. And it's going to take a while for these health plan systems to get all the codes loaded correctly.
Macrina, one of the questions I got was, is VFA going to start back up again soon? They ran out of funding. They're saying they ran out of funding, question mark.
So we, for Maricopa County, we just got our allocation and we can order vaccine, but I need to give that with a caveat. Our VFA budget did not increase this year. So in Maricopa County, we have $800,000 and we have 52 providers, including 4 Maricopa County clinics. So I believe, unfortunately, that we will run out of VFA funding sooner than later.
And that, I'm sure that will be, you know, the other counties, it would be the similar. No matter where you're at in the state. It's just not a lot.
Right.
The VFA money is,
There's just not enough
few.
money for uninsured adults. There just isn't.
Again, another like cold reminder of what it's like in reality when we're not in a pandemic, for uninsured people. And is anyone taking, how would a clinic get on to VFA? Or is there?
You've got to contact
Yeah.
ADHS,
Okay,
and then
so
ADHS
contact
will
ADHS.
refer them back to their county health department, because
And-
VFA goes through their county health departments.
Okay, and some are saying that they've been told that there is not, people aren't taking on more VFA clinics. Again, it's just so small.
Again, it's just such a small amount of funding for something like Maricopa County that has 56 providers and $800,000 for all of the adult vaccine products out there. It just goes so quickly.
So there's discussion on where can we find the COVID 12 plus fact sheet?
I put the links in for how to order vaccine, and each one of those sites also has their fact sheet listed there to print out.
Okay. And you can still, Macrina, we can still swap products, right? Like Pfizer and Moderna if needed, if it's a 6-month to a 4-year-old.
Yes, we can swap the products.
Yeah, if you have to do.
If you have to do it, Pfizer and
and then
Moderna
Pfizer
are
and Moderna.
interchangeable.
Okay, conflicting answers. Currently, you answered that, yeah. Yeah, VFA is for uninsured only, we think.
Correct.
Anything else, guys?
I know it's confusing. It's confusing for us. I mean, it takes fingers and toes for us to count on the different programs and sticky notes to figure out the caveats.
But
It's
I
a
think
lot.
it is, but we have to remember, like, this is normal. Like, this is what it's like when new vaccines hit, and we don't like that answer, but will there be a Pfizer 12 plus years?
And I also think that this is the first time that we've ever, I mean, this is the first time in my 32 years of vaccines that we've ever gone from emergency use authorization of a vaccine to the entire population and then commercialized it. I've never gone through this. I don't think anybody's gone through this. So I think we're just trying to figure it out. And it's going to be really bumpy for a while. But we'll figure it out. We'll get there.
One of the questions is, can we order it? So you can order it, and for VFC patients, it's on your order sets, right?
Correct.
And then for privates, you talk to whoever you get vaccine from.
Right.
So-
We were able to order it through Cardinal, who we normally go through.
And the manufacturers are, you can contact the manufacturers too. I know Moderna sent out an email saying that you could order it. Oh, okay. Will there be a fact sheet for Pfizer 12 plus years? Wouldn't that be just a VIS now that it's regular, or that it's full approval?
Should be VIS.
But they had fact sheets on there, so maybe on their website, I did see some. I'm not sure if they had 12 plus up already. I think they did. So they are still calling it a fact sheet on the manufacturer's site, but eventually it will have a VIS just like an MMR does.
Yeah, we should contact IAC to see. They might know. The Immunization
Yeah.
Action Coalition. They're the ones where you probably go to download your VISs in every language imaginable.
And standing orders, all that stuff.
Yeah. So if a 6-month to 4-year-old patient received 1 or 2 doses of Pfizer, they are able to finish with Moderna.
Yes.
I think I missed one up there. So if we order VFA vaccine, we can't order the COVID vaccines from the VFA. I'm sorry, I interrupted you. I spoke over you as usual. Can you please say that again?
Well, you and I both do that, so we're used to it. If you have VFA now, you can order COVID starting mid-October. COVID Bridge hasn't rolled out yet. It's still coming.
Correct. And it's just like if you order VFA flu, it's not available till after October 1. So these vaccines do come out later. COVID will just be later than flu.
Any other questions?
Found the 512 plus fact sheet. Let me stick that
Oh,
in
you
the-
did? Okay, good.
It was on FDA. See, wrong website. Keep searching too many.
Well, thank you all. This is as painful as this is. Hopefully, we get these vaccines out and you have fingers crossed for a much better respiratory season than last year. Especially for our kids who couldn't even fit in our children's hospitals. So we are really hopeful for a better season for you all. Wishing you all the good, all the good wishes as we start going into fall break and everybody comes back sick. So we will be sure to put the slide and all of these links and everything on our website. And we'll email you when we do that. And keep all of your questions coming to us. We're here to serve you. And you're the ones that let us know what are the things we need to be looking up, asking CDC and all of those things. So thanks to everybody for everything you do. And we will see you next time.
Thank you.
Thank you.